Junction Health was founded to, number one, serve the needs of communities of patients that otherwise struggle with access to life-promoting infusion medications, and number two, drive economic value into federally qualified health centers. What we discovered was that for a lot of metropolitan areas across the country, really only anywhere between 10 and 20% of infusion centers were accepting patients enrolled in the Medicaid program.
Patients don't have this access to care. So what happens is they have to go to the emergency department, they're hospitalized, they're not able to live their best lives. So with Junction Health and community health centers, we create a formidable powerhouse of a team working together to change the realities of too many patients going without access to care.
Primary care providers at these essential community health centers, by their nature, they're focused on trying to take care of as many of their patient needs as possible because a lot of their patients lack access to specialists. Drug infusions is a unique type of a business. There's completely different billing, there's completely different safety measures, and so that's where we come in. We're there to bridge that gap.
We're able to create a new chapter in the rich legacy of care that community health centers have had for over 50 years. We think about a time when health centers weren't able to offer HIV care through Ryan White program, or hepatitis C or substance use disorder services weren't available. At Junction Health, we have the honor to be that partner as community health centers continue that story, continue that legacy of care to provide more and more comprehensive services for communities and people that just don't have that access today.
And what's unique with this partnership is that we are able to plug into outside virtual specialists, gastroenterologists, rheumatologists, hematologists that can plug in to virtually consult with those primary care providers. There are a lot of chronic conditions that do require infusion therapy. Conditions like Crohn's disease or ulcerative colitis, rheumatoid arthritis, and psoriasis. So there's just a lot of conditions that we're able to treat because of these breakthrough therapies that are really only available in a drug infusion center.
There are challenging economic realities that federally qualified health centers face today. There are declining reimbursements, there are shifts in federal and grant funding, there is a lot of uncertainty in historical revenue streams that health centers have been able to depend on. And that's where we've been able to step forward with a comprehensive solution for infusion services.
The principle of partnership is essential for Junction Health, and it reflects back the experience that I had as a former FQHC CEO. We would have ideas around ways that we wanted to serve the community more impactfully, but the challenge was the resource constraints. So Junction Health is a solution for that. We integrate with the existing referral process. Once we receive that referral, we take everything from there, whether it be the pre-authorization, whether that be the administration of the therapy itself, the revenue cycle, the reporting back to that referring provider. All of that is provided by Junction Health so that the community health centers can really continue to focus on their core services that make them the essential community provider that they are.
When we come in and partner with federally qualified health centers, we really are that. We're your partner. We work with your clinical staff, your operational staff, even the construction oversight to implement the project from start to finish.
Grounded in a belief in the dignity of every human person, patient experience is one of our highest priorities.
We want it to be a healing environment, which is why we decided to exclusively offer all private suites. It feels more like home than it does in a clinic where maybe it's one room with multiple chairs.
We work with an interior designer to make sure that the space is beautiful, functional, and comfortable for our patients.
So what we found validating with our business and clinical model is the energy behind it from all stakeholders. Initially, when we first went in to work with federally qualified health centers, we were a little bit nervous about the response from local community-based providers, hospitals, and health systems. But what we quickly learned is that all of them are concerned about the health and well-being of patients, regardless of their payer source or ability to pay for services. And we're bringing a comprehensive solution that addresses some of those gaps. And it's been really fun to experience the energy that everyone has behind this model.
If you're at a community health center, you're the CEO, you're a member of the leadership team, and you're looking for new ways to unlock access to care, maintain that fidelity to the core mission while also looking to identify ways to diversify revenue streams and create that self-determination so you're not reliant on federal grants, please let us know. It would be our honor to work with you and to be your partner.